Hello, everybody. Good afternoon. No new deaths over the last 24 hours. Good news again there. Certainly 207 of our neighbors we've lost during this pandemic. But good news to start out the briefing. Received over 4,000 tests back since yesterday in Onondaga County. Big day of testing. And our 7-day rolling average is 1.07%. So we've seen upticks over the last 2 weeks. Essentially, some things are different over the last 2 weeks. What we've seen with cases, certainly we had our first major cluster at a college with Syracuse University. Things have leveled off there, so we feel good about where that stands. But again, when you look at a 2-week increment of cases, about 100 cases from one situation, that's a lot. And so that's going to hit your data. But we were in a very good position before then, so our numbers really didn't move to a place where they're uncomfortable, although there's things that we need to improve on as a community. Looking at hospitalizations, 14 in the hospital. That's down 2 from yesterday. I think we had 3 new admissions, but we had 5 discharges. We still have 4 of our neighbors in the ICU, so certainly please keep them in your thoughts and prayers. But 14's going in the right direction, so very happy about that. We've made good grounds with people getting better over the past week here. Out of the 14, 10 Caucasian, 2 African American, 1 Asian, and 1 of unknown demographic. They have not shared that information with us. Looking at cases, better than yesterday, still a little too high, up 36 cases, so 36 new cases. We've now had 4,668 positive cases since March 16th, so essentially 1% of our population. We've fared well to get to this point. Many communities got to that number a lot sooner than we did, but certainly the virus is here, and we need to do the things we need to do to protect ourselves and our family. So out of the 36, what's the story behind the 36? That's what's key in this. 5 travel-related. We had 2 from the state of Pennsylvania, 1 Maine, 2 from other parts of New York. 7 household contacts. Again, once we have cases, we know there's a 15% chance, basically, after been going through this exercise since March, that if for every case, you'll have that 15% household contact number. So if you have 10 cases, 1.5 new cases, just because of the inability to isolate successfully in the living quarters. So 7, that's higher. Again, we've had an uptick in cases. We're going to have an uptick in the number of household contacts. 1 senior facility case, 23 community spread, 12 known source, 11 unknown source. 5 of the 36 related to higher ed, 5 of the 36 related to lower ed. So overall, again, better number today, but the trend that we're still seeing is folks getting too comfortable, going to work sick, and the virus is very contagious, getting other colleagues sick at work, getting people sick and spread through the community when they're out and about. So again, our ask, and we've been saying this all week, is we need you to stay home when you're sick, get a COVID test. There is capacity. Labs are turning things around in short order, so we need you to do that. If we did that, we will be in very good position going into the peak flu season related to COVID, which is key. So please stay home when you're sick. If you have symptoms, get a test. Remember, symptomatic testing is covered by your insurance. Won't cost you any money. And that's what the community needs from you. Too many small little pocket clusters of one case going out to work, getting someone at work sick, going to dinner, getting someone else there, getting a family member. Next thing you know, you got quite a few little cases where you got 3 or 4 different little clusters based off of one decision to go to work sick. So please, please, please work with us on this. What we do today will drive our data in 2 weeks. So if we can turn this around today, we will see very, very good data in 2 weeks related to the virus. Breakdown of the virus since the March 16th date, 2,646 female, 2,022 male, 530 under 19, 1,021 in their 20s, 612 in their 30s, 558 in their 40s, 663 in their 50s, 493 in their 60s, 339 in their 70s, 284 in their 80s, and 168 in their 90s. School testing, just to reiterate, for symptomatic school testing, NBT Bank Stadium. We have 2 partners there now and quite a bit of capacity. The saliva test, which is the popular test for kids, where we do have demand issues each day. If you want to register for a saliva test, you either call 315-464-2582, select option number 4, or you can go to mychart.upstate.edu, probably easier, and then you can go online and schedule your appointment. That's the saliva test. Yesterday, essentially there's about 180 type capacity a day, Monday through Friday, for the saliva test. Today, I know we had over 150 appointments for that, so that capacity's being pushed. So what did we do? We brought in our partners at Cayuga Health, so you can do the regular PCP nasal swab as well. And again, that you can show up 9 to 1 and then give your information, or you can pre-register at register.cayugahealth.com. We have the capacity right now for about 200 tests a day with that, and we haven't really met that capacity. So again, if a parent, I know we're pushing upstate because easier for kids, better experience, and at schools, but if you can't get in right away, if your child gets sent home on a Tuesday, you can't get in on a Wednesday, you can get in on a Thursday. If that's too long, you can go to another testing site or come down the next morning and get a nasal swab. And again, Cayuga Health, turn times have been very good. They got backed up over the weekend because they pinch hitted and helped out Broome County for the weekend with what was going on in Broome County, very high rates there with some serious clusters. They're now caught back up. So overall, the turn times really at these 2 labs are 24, 36 hours. I got a saliva test, got it in, I'm negative, and my turn time was about 30 hours, essentially. So very good turn times. Asymptomatic school testing started today. We were in Jordan Elbridge Middle School at 7:30 this morning. It's a voluntary basis for asymptomatic testing for the faculty. And at some point, we'll bring in kids to this process. But right now, the data has shown us that there's more cases in the buildings with faculty. Some of the spread outside the buildings has been faculty getting together. So that is something we started Jordan Elbridge. Tomorrow we will be at Seymour Elementary, and Monday we'll be at East Syracuse Elementary. Again, we're picking some of these schools that we've seen some cases at. So we want to go in there, look for asymptomatic potential carriers, just like we did when we saw senior facilities early on in this process. We would see a case, we would try and get in there and test the whole building to find that asymptomatic carrier. So that's something that we are doing and we will continue to do throughout the year. Certainly, but if you are symptomatic, you go to MBT Bank Stadium or another testing site. This is for asymptomatic testing. We talked about this. There's still overall globally, we've had a busy few weeks here. We had a first large cluster that we dealt with based off of a party that happened at SU, right? We've gotten through that now, so that should help with our caseloads. Now we need to get through the issue of leaving the house when we're sick without a test. We got to eliminate COVID first. And if we can get through this, we'll get our data to a point where we have a better argument to the state about helping out some of these industries that are on the sidelines. if we want to get fully open, or we want capacity to get open more for some of our restaurants going into the winter season, we need to have the data there to make that argument. So I need your help so I can continue to advocate for these businesses. And for the business owners, there's been more complaints at some of your establishments, so we have to investigate these. We had a great summer, and I think we got a little COVID fatigue. We got to re-engage, so we're in a position going into the flu season where we can take a little bit of a hit, and our data doesn't start getting to the point, and our infrastructure doesn't get to a point where it's strained. And saying that, I just want to encourage everybody to get a flu shot. We have capacity in the community. I received mine yesterday. It was wonderful, and hopefully we can get everybody doing this. We'll do some strategic initiatives for our vulnerable communities that we'll be talking about later next week, but specifically, go to your pharmacy, go to Wegmans, get a flu shot. This is a mitigation tool that we can all use so that we're not getting sick with things that look like COVID. A lot of people get hospitalized with the influenza A and B. We heard that in the beginning of this process about how we were handling the pandemic. Well, don't a lot of people die each year of the flu? Yes, they do. So let's get a flu shot to help limit that. Every respiratory illness, we have to rule out COVID in the pandemic. That means a lot of tests, which could strain our testing capacity and our supply and our turn times, but it also could mean stress on our hospitals with hospital beds. So let's get out in front of this. We know this. We can do this. Saying that, happy to take a couple questions.
Ryan, the increase we've seen over the past 2 weeks, is this the start of a second wave of the virus in Onondaga County?
I've been thinking about that. So I looked at where our cases are coming from and broke it down. About 25% of the cases, for the first time, we had a cluster at a college. We had a small one early on at SU, and then you've had some, positive cases, but nothing like a cluster. Essentially 100 cases over a period of a 2-week period of time. So under the assumption, Jim, we're through that, right? And we feel pretty good. You had 20 positive, 20, 20, 10, 6, 5, back into a range where you'll catch that occasional case of COVID. If we can wipe that from our data moving forward, our data gets to a much more manageable thing. So then what else does it tell us? It tells us clear highlights that there's unforced errors being made in the community. People are getting tired. And it doesn't take much for that to happen into, 1 or 2 mistakes where you're sick and you're doing too much without getting a test can lead to many, many cases. So I don't think we've seen a second wave yet. I think we saw a cluster, and I think we have seen the community at times getting a little too comfortable, myself included. And so now we just need to, re-engage because I think we'll see more activity when the weather really turns, and when everybody really has to get indoors. So we want to be in a position where we drive this data down, where we starve this virus to a point where when it has better circumstances for it to spread, we're at a point where our data is very, very low. So that's really what our plea is now. Let's get things back to under 1% going into when we have to be indoors more, where we know we're going to see upticks.
What kind of plan can you dust off from March, April, or May that may be helpful if there is a second spike or even an uptick, a wave? I don't know what you want to call it, but what things are you able to reinitiate if needed?
So we're already building up testing capacity now, looking at that as a way to try to find the next cluster. There's some things out of your control, right? This is a virus. Many people get sick. It spreads. We don't know where it is, right? You find out after the fact. And so the ways we can try to work on this in the preemptive side is to do the asymptomatic testing in strategic areas. You do the flu shots. You wash your hands multiple times a day. distance when you can, when you're not distancing, wearing a mask. So these are all things that we know work, but there's nothing that works 100%. So we know we're going to have cases, so we have to get to the point where we're in a very strong position going into when we all get back indoors. And we know then we'll see upticks. We know that. And then we deal with it. And we quickly contact, trace, and quarantine and make decisions. So what's unique about the last 2 weeks really was the cluster at SU. We didn't have that yet, so it happened. Now we're going to be on the back side of that. But if we change our behavior and we're more cognizant of our behavior about being sick and going to work, if we don't do that, or kids being sick and getting sent to school, then we'll get ourselves in a good position going into the really winter months. And it's about buying time. We're tired. We've been through a lot together. We're certainly in the second half. Some people say we're in the beginning of the third quarter. Some people say we're in the end of the third quarter. But science is almost there for a vaccine. And then once it's there, then we get our vulnerable vaccinated, and then it will take more time to get everybody vaccinated. But it's about doing what we know has worked for us through the rest of this process. And it's tiresome. I get it.
You segued into my next question very well. Is the county, the Office of Emergency Management, the health department, do you have internal conversations in what your role could be in vaccinating your community?
Sure, and I think we'll work with the state on that too, and certainly the CDC guidance leans on local health departments pretty strongly. Whether the state decides to roll with the CDC guidance, we'll do it, but it's impossible, right? The state of New York's going to need to work with the counties. We have the emergency management departments, the health departments. They're the regulatory agency, so they don't have the personnel doing the boots on the ground work for the most part. That's who we are. So that's how we team up and we work together. So certainly there will be a rollout strategy that I know the state's working on, and certainly the counties will be a large partner in that.
Do you see yourself setting up or hosting vaccination sites like you have been with testing?
Yeah, I think we will. Certainly, I think you'll see those happening, and probably multiple sites throughout the community once the vaccine's available.
Governor Cuomo has said that about 400,000 rapid testing machines are going to be going out through the state, provided by the state. Do you know or have any idea of how many Onondaga County will be getting?
Yeah, we've asked for about 200,000 of them. So the state will most likely get about 5 million from the federal government. And I think in our plan that we put forward, we asked for 200,000. I believe we'll get some soon. And then we'll work those into certainly our MBT Bank Stadium site. Mind you, I believe the rapid test is a antigen rapid test, so not as accurate as the other testing we're doing, but again, a very good tool.
Has your office heard a lot of complaints lately about access to that, needing an appointment, getting back to work?
Yeah, you have, and look, people get it, right? So people want fast, and they want fast, and the technology is getting better, and the rapid tests being produced today are better and more accurate than the ones that were in the beginning of the process. So we don't want there to be disruption either. So that will be another tool we'll have in our testing toolbox. I don't know how many we're going to get right away, but certainly, hopefully we'll get something at least substantial based off our population and the fact that we're really servicing all of central New York and parts of northern New York. So that's something that we have a good idea. And again, we bought rapid testing machines, 4-hour turns, right? These are the 15-minute variety tests. And we're continuing to look at purchasing more infrastructure that will help us get through this. And so I think I have a call later today with a vendor about a rapid testing product that is new. So we'll continue to use all of these tools, and then the rapid testing, you're not going to just offer it randomly. You're going to use it surgically, because if there's 400,000 in the state, whatever they send me, it won't be 200,000. So probably going to be something a lot less. So that could quickly be run through if you don't use it the right way.
On Tuesday, you had the 3 cases in a single nursing home. You mentioned one additional case at an elder care facility in your data today. Is that the same nursing home? Are we seeing that become a problem or taper off as an isolated 3?
I don't know yet. I do know it's an employee, though. It's not a resident. So that's, we get very concerned when we start seeing the residents getting impacted by the virus. The employees are out in the community living their lives with their families. So we're watching it closely, and again, we're implementing wastewater testing in these facilities and going to be rolling those out with various properties.
I think Dr. Gupta said yesterday the 3 you reported on Tuesday were also employees?
Correct.
Were there any yesterday?
I don't think we had any in the senior
So you had
facilities
3
yesterday.
Tuesday, 0, 1 today.
Correct.
You don't know if they're connected.
I do not know if they're connected at this point.
What's the status of the state response to your proposed executive order?
I haven't gotten it back yet, but we're whether or not I even need the state's approval on that is question mark. We're not going to not do the wastewater testing. We're doing it. There's no reason why we want it, and I don't even think we need permission from the buildings, the waste, and it is literally waste we're testing here. It does not have ownership through the infrastructure, so we're going to do that. And then where we would need cooperation, that's why executive order certainly should hold the weight with the private owners, is that to get in and test the residents once we find it. And again, why would you not want us to do that? That would be newsworthy if a facility knew that there was COVID in the waste in the facility, but they wouldn't want us to test people. That would be very, very bad. So again, this is common sense stuff that, but part of our proactive strategy going into what we do, whether it's a second wave to Jim's point or increased pressure, we'll see, but we know it's coming.
Are you worried about the economic impact that the cold weather has, these restaurants not being able to serve outdoors, or people still trying to go out but being more packed into a restaurant?
I am, and I think that's why we're working with some of the businesses on ways. Is there ways for tents to be purchased? The heaters are very much in demand, so that we can continue to learn how to really de-densify and still operate at levels that lead to some success for these businesses. Canadian cities do it. We haven't. We're not great at embracing winter, even though we know it's coming every year. Sometimes it's even longer than a season. So we need to get better at embracing it anyways. So this might be an opportunity where we're forced to embrace it, because certainly more people are comfortable outdoors in some of these settings. And certainly I know our health professionals are very comfortable with that as well. So we're going to work with the restaurants that have the ability to potentially do this and work with them so that they can.
I thought Syracuse was good at winter. Are you suggesting that maybe Canada, what do? Actually have more outdoor seating?
They have,
Canada
yeah, outdoor dining is it's the norm in the wintertime, and you have a fire pit or a heater, and you have your jacket on, and you have a nice meal, maybe a cocktail, keep you warm. And that's what Ottawa does, and Quebec City, and Montreal, and Toronto. And certainly something that we haven't really had to do, but we haven't seen this type of virus in 100 years.
You say working with the businesses. Are you purchasing it for them, facilitating the orders?
Yeah, we're looking at some sort of grant program, public-private partnership that would help these businesses do this. Other questions? Okay. Thank you, everybody. We'll see everybody